All right, so we are going to continue talking about reality therapy. Here we're looking at its evolution. Um, Many theorists have people who become interested in their theories and want to learn more about it, and in doing so, they tend to make it more of their own. Well, Robert Robalding, he's one of those individuals who found himself fascinated with Glasser's work, wanted to learn it, practice it, wound up becoming uh, a key figure in his own right for this particular paradigm and therapeutic technique. So, what I'm going to go over really briefly, not intense, but just enough so that as if you watch the video, you kind of understand where Balding was coming from as he worked with the young man. And this is his method for reality therapy that is really something that we find is good in many different scenarios in different ways. So before I get started though, I just want to give a refresher in terms of talking about what is reality therapy and what is choice theory. So let me just say, Glasser went through phases in which he came up first with reality therapy, uh, and he then moved from reality therapy, seeing that okay, there's so much more to this, that he then developed a theory that was considered to be control theory. However, he's since evolved from that and then finally came up with what we know as choice theory. So reality therapy didn't go away. Reality therapy is the intervention itself. It is the process that you would use choice theory in. And hopefully that makes sense. And if you already watched Balding's video, he goes on and describes that in a little more detail. But reality therapy is the vehicle we would use when we're trying to help another person in discovery, in learning, and to be able to shift in terms of understanding their basic needs. So I just wanted to go over real quickly again what those 5 basic needs are. And so the first one is survival. And of course, that's looking at our physiological needs. Here we have the desire to be able to obtain food. We want a roof over our heads. Safety. We want to make sure we're in good health and able to reproduce, have families, children. Now, within this, there's only one physical need, and the rest are psychological. Which one would you say it is? I'm not going to tell you. You can tell me later. But let's move on. Let's talk about love and belonging. Here, this is when we're trying to connect to others by developing our relationships, being in touch with our family, with our communities, and a form of intimacy. You could take this particular need and consider it the most important need because our other needs are often met through the relationships we develop. The third one would be power, and that is under the guise of our achievements or our inner control. Here we're looking at what we achieve in terms of our level of competency. How much do we know, not only about the world we live in, not only about what we do for our careers, but for ourselves as a human being? How much do we know ourselves, and how much do we know of others? Um, it's that ability to be able to recognize, know our own accomplishments, and to be able to see the accomplishments and give praise to others, as well as understanding our own self-worth. So now, when you hear the word power, what I don't want you to think about is domination. It's not about that in any sense of the word, but it's understanding our level of capabilities, being able to see ourselves as someone of value for ourselves and as well as for others. The fourth one is freedom. And with freedom, of course, we're looking at one's level of independence or autonomy. So, in this particular need, we want to be able to make our own choices. We want to express ourselves in terms of innovation and creativity. We also want to be able to have that independence, not having somebody tell us what to do. One of the things I try to express to others when they're doing counseling or therapy is that we're a guide, okay? You should not be telling your clients how to be. You should not be telling your clients what to do. We ask them to use us as a mirror. We use reframing, rephrasing, and helping them to see themselves through the discussions they provide. All within the guise of us just being a back person, so to speak. We're not direct, and we don't necessarily be indirect or non-directive, but we don't tell anybody what to do. That's not therapy. That's not counseling. That's being a hindrance, if you ask me. So when we're talking about therapy, it's allowing that client to be able to see the desire of control that they would have over their own life, helping them to be empowered. Not and that's a big feeling for freedom. When you feel empowered, you're you're in control, your confidence levels are going to be up, your self-esteem is higher, you're able to cope and deal with things easier. You won't be accepting negativity, you won't be depressing, you won't be, pushing yourself to negative thoughts. You'll think better of yourself. And then if there's the fifth caveat or fifth need is fun, having fun, enjoyment, being able to learn the different ways to be content. So, and that means we have to have a need to play, we have to have a need to laugh, and in doing so, it allows us to learn the possibilities of things that can make us even more giddy, more happy, more content with the world that we live in, and enjoy it. It's in this phase that Glasser really emphasizes that having fun is vital for our well being and is usually the most overlooked basic need in our adulthood. As children, all we know is having fun. But as adults, we allow responsibilities of trying to attain the other needs to take precedent, and sometimes we wind up repressing or pushing away fun, which we need to make sure we incorporate that and bring it back into our lives. So, know that when we're talking about reality therapy, it's us being able to understand that when our clients are struggling, it's often because there's one or more needs not being met. Now, as we go forward and start talking about Wabalding's work in terms of WDEP method, that's going to help us to be able to explore their wants, what they're doing, how it works, and being able to kind of plan things out. So I just gave you a hint of what depth means, but we're going to go into that a little further. Okay? Just know that though, when we're talking about this particular area, we're talking about how we can go about attaining those five needs or being able to help our clients to attain it, being able to look at it. Okay? being able to see it, attain it, be able to measure it, know the immediacy of it, as well as be controlled, allowing the client to be in control. Okay? So those are the 5 basic needs. We're going to move on and talk a little further about with depth. All right. So again, this all revolves around reality therapy. Okay? And again, the emphasis is our ability to be able to make a choice, taking on responsibility for our present behaviors. And that's what we as clinicians would help our clients to do. Again, this has been developed by Robert Wibalding, and then within the framework of reality therapy. Again, choice, responsibility, and present behaviors are the key facets. And creating structure in which there's 4 steps that we would help our clients to work through. That being wants, doing, evaluation, and planning. Let's start with wants, okay? So when we're talking about wants, there's one question to ask. What do you want? It's where we start to help a client to explore their desires, their needs, their goals, as well as their perceptions of the world and how they fit within the world. This would include both surface type of wants, where the example can be, I want my parents to leave me alone, if that was an adolescent, for example, or deeper needs like loving, belonging, and power, freedom, fun, and survival. Being able to touch on that, wanting to belong, wanting love, wanting to be autonomous or independent, wanting to be able to pay their rent, put food on the table. These are all basic needs that we desire to always accomplish. Now, again, I need to stress that as we're working with our clients, the key facet is that we trust our clients know that they're needing help or needing something. So we take their word for what they say and how they go about doing it. Okay? We try to avoid being judgmental, and instead we'll help clients learn how to articulate their wants and their desires and help them to believe in themselves. That's going to ultimately give them, satisfaction in how they're living. So one example I can provide you with is, let's take, y'all are all graduate students. So let's look at a graduate student that would say, I want to pass my course, I want to pass the class, but I also want to be able to go out every night. I don't want to have to sit here and listen to Dr. Kearns-Cooper lecture. I don't want to watch video lectures. I want to party. I want to hang. In this case, you as the clinician might try to help that student get clarification of what they really want and what would be more important to them and how it would align with long-term goals. Because they're thinking more in the short term. They're looking for instant gratification. We all do. But sometimes we have to pull them in. Well, John, why are you in school? What's the purpose of you going to graduate school? Hopefully, John will be able to discuss and speak about the career choices he's trying to make and how he would like to see himself as a clinician one day. And it's in that realm that we can help pull them back and help them to gain understanding of what that want and desire is. And you would try to also let them know where they are going to place that and how they can achieve it. So that leads on talking about doing. Doing, when we're talking about doing, it's like, what are you doing? How are you trying to do what you would attempt to achieve? Here it is when we want our clients to be able to describe their current actions and behaviors, be able to talk about the thoughts that they're having as well. So We try not to be too far in the past. We want to be in the present, in the here and now. But let me say this. I'm going to kind of put my own spin on it. As I mentioned, that my theoretical orientations besides reality therapy is also do include psychodynamics. So I do see benefit in allowing a client to understand where the trouble might have started from. But I also bring them back into today, the here and now, to show how it's impacting them today and how we can't reflect on the past, but we can change the present to create a different future. Hope that made sense. So again, you want your clients to be able to focus on the present and not on the past. This is a stage that really emphasizes the direction. And although, like I mentioned earlier, we don't want to tell our clients what to do, but we do want to guide them to be able to start seeing things in a different light for themselves, where they can understand that their current behaviors will be affecting them and taking them where they may not want to be, but they're allowing it to be there. For example, when we say in doing, if a person tell me they're depressed, then I might ask them, well, why do you want to be depressing? What do you mean I want to be depressing? Well, we choose, we make a choice. So if you're depressed, you are choosing to be in this state. What are you doing to change it? You see, and that's how you would be able to bring that back into play. That's the direction. Not me telling them what to do, but possibly pointing out some of the behaviors that's keeping them from achieving their goals. So, saying it in another type of example, let's go back with our graduate student John. He claims he wants to have academic success. However, he's been skipping classes. And well, this is where I might want to highlight that particular discrepancy and say, well, John, your actions are leading you away from the goal you said you wanted. You said you want to be a clinician, a counselor at the end of this, but what does skipping class do for you in the long run? And so I'm not being judgmental, but I do present him with a question that is more for himself than the answer for himself than to answer me to. Okay? And it'll lead him into what we call the evaluation. And I might ask him, is what you're doing, I'm sorry, I'm busy talking and I'm forgetting to move my slides. There we go. We're up to evaluation. So I might ask him, is what you're doing helping you get what you want? Is partying all night going to get you your degree, your master's? Is it going to help you work toward a doctorate if that's what you wanted? And you got to know that this is really a critical step. It's always good for us to be able to reflect, hit these assignments I have you doing, but to self-evaluate rather than having me be judgmental and kind of try to throw monkey wrenches left and right to you. When we're not being judgmental and we're just being a guide and we're opening this up for our clients to start looking within themselves and to do self-evaluation, they start to recognize their current behaviors and see whether or not they're being counterproductive. And in that process, that realization will help in terms of whether or not they truly want to move forward, truly want to develop different behaviors. And if that's the case, then that self-awareness will help create motivation to help that client change due to that realization coming from the client, not from me, the therapist. if that makes sense. And I remembered, yay! But here we come to the fourth stage, which we considered planning. And not only planning, but a commitment to planning, okay? So, in this sense, we ask, well, John, what's your plan then? You said you understood where going out might not be conducive to your overall long-term goals. So what do you plan on doing? This allows you as a counselor or a therapist to help the client to be able to come up and design a more concrete, realistic, as well as an achievable plan to carry out what they want more effectively. Well, Baldwin talked about how we need to follow what they call the SEMEC guidelines. That being simple, that being attainable, measurable, as well as immediate and controlled. Okay? So, an example of that might be, and hold on, I'm going to move forward again. Although that's not broken down much here, we'll leave it here. But again, when I'm talking about SEMAC, I'm talking about simple, I'm talking about attainable, I'm talking about measurable, immediate, and controlled. And when I say controlled, it's not you controlling the situation, but the client controlling their situation. So an example you could take from that is the client is vaguely trying to promise that they'll do better. And when they do that, they're saying, they're going to commit to trying to. So instead of saying, well, I'm going to commit every day, John might say, well, I plan on attending Monday, Wednesday, and Friday classes from here on out. And that he might try to limit his social activities or outings from 5 nights a week to 2. Again. And of course, upping the ante a little bit and studying a bit more, maybe an additional hour. There's simple tasks that he's including, but ultimately, if he is able to practice all of that, he's going to start meeting his goals in a way of helping him to achieve by passing his courses, by being able to move to the next level, by earning that degree. So that's what SEMIC would be in helping. So let's talk about strengths now, which is the slide we finally are on. When we're talking about the strengths of WDEP, we're looking at how it's a client-centered approach, and that we have to remember the client will be doing most of the evaluating and planning. We don't do that for them. They do it for themselves. We look at the practicality as well as the structure of this particular intervention, and actually see it as how it gives us both a process to follow, a protocol. Not just therapists or counselor, but the client themselves. We're there in the driver's seat. This is a particular intervention that is future focused. There's going to be an emphasis on problem solving or coming up with solutions that will look to the present moving forward and not on our past mistakes. So although we might want to know what created the depressed, we don't want to linger on it. We don't need to ruminate about it. We need to move forward. Then this is also adaptable. Adaptable in the sense of if this is a particular intervention that allows us to tackle different age groups. Now, you're seeing tonight how it's to work with children, but I guarantee you this works with adults as well. Okay? So that's where we are. Not only age groups, but I also need to mention that culturally, you can apply this particular intervention to various cultures, but you need to make sure you're aware of the culture, not just throw it in there, but to make sure it's adapted to that person and their belief systems, their value systems, their perceptions. It needs to work for them, not for the overall picture, if that makes sense. So, here's where your self-evaluation and your reflection, I will make sure that these questions are included in Moodle so that you are able to answer them for this week's assignment. The discussion questions are for your reflection. Why do you think self-evaluation, which is E for evaluation, is more effective than our judgment, the therapist's judgment? How might the WDEP process be adapted for children versus adults? Is there any differences or anything that we might have to do special because of the age groups? And then think about and tell me what barriers might clients face in creating realistic plans, and how can we as therapists help them to overcome it? So those are your three reflection questions. And again, no more than 2 pages. I just want a good little paragraph for each, that allows me to see that you understand what we're talking about tonight. And so I put them here so you can see them, but I'm going to also have them up as well in Moodle so you can answer these questions. And I'm sorry that I've been slow on my PowerPoint tonight. I just got real chatty and wanted to talk, to which usually I say what I want to say on one slide, stop, go to the next slide, and do it that way so I don't drag like I did tonight. But it's okay. Um, the end result is I hope that you were able to gather some good information about reality therapy choice theory. I hope that you understand the concepts behind Wabalding's work in WDEP. And again, hopefully you'll be able to use this within your own counseling of your clients. Thanks for listening. I'm going to stop here. If you haven't watched the video, please do watch Wabalding's video. It's a three-parter. You got the introduction with him and the host, where they talk a little bit about reality therapy and they talk a little bit about what depth and what it is. Then you'll go into the longest part of the video is him working with a 15-year-old African American male. You'll get to see that up close and personal. And then finally, there'll be a conclusion, but also a Q&A where other professionals ask some good sound questions about reality therapy and how that whole process works. So I'm stopping. I want y'all to have a great week. Next week we'll probably be getting more into chapter 8, looking at different other techniques, and I'm going to also try to probably include another video on childhood interventions. We'll see about that though. All right, on that note, have a good one.